Good afternoon. Welcome, everyone. Thanks for joining us and welcome back to our monthly live conversation with Sally and Margaret from the Vermont Department of Health, Division of Maternal and Child Health. I just want to acknowledge that many of us are beginning to feel really worn down and we're wearing thin from persevering through this pandemic. I have moments of despair, and then I think of the daffodil bulbs I planted last fall, and I find hope in the promise that spring will come. So I know that daffodils are not a magic wand, but it brings me hope, and I hope that you are finding something or some idea that helps you to find hope as you continue to persevere. I'm so glad that Sally and Margaret have these conversations with us once a month. And today they have a full agenda with a lot of updates and a chunk of time for questions and answers, and some of the questions you've already submitted. There is the Q&A box which is where we ask you to please put any questions that come up for you that perhaps you didn't submit ahead of time. And just remember that they share a lot of links, which are really helpful links for the work that you're doing. And those are not live on your screen during the presentation. They are live when we post after the webinar is over, and we post the slides and the recording of this conversation on the Let's Grow Kids website. So when you find it there, the links will be live, and you can always call the warm line. And I know they'll remind you, Sally and Margaret will remind you of that a few times. You are all muted. So again, please use the Q&A for any questions that you have, and I'll keep tabs of those. We'll get in as many as we can today. If we don't get to a question that you pose in the Q&A today, just know that Sally and Margaret will answer it, and we will post that on the Let's Grow Kids website next week. So I'm going to hand it over to Sally Kirshner and Margaret Tarmy now to begin our conversation and to hear about the updates from the health department. Thank you. Thanks for joining us, Sally and Margaret.
Thank you.
Great. Hi. I'm Sally, and the other one is Margaret, as you may have figured out by now. I'm just getting used to my screens. I moved my screens around, so I'm talking to my other screen and not into the camera. But anyway, welcome. We have our usual pattern for speaking with you folks today. We have updates from the health department. I think this is another slide too. Yeah, oh there. Updates on COVID from the health department. Margaret will go over the last time, the childcare data. Last time we had data on K through 12 schools, and now we have some childcare data that gives us a picture of what's going on from the epidemiology point of view as compared to what you guys see every day in the real life view on the front line. And then also time for questions and a discussion. So, next slide. Does this all make sense to you? Brenda or Kathy, do you need to add anything to this?
Nope, thank you.
Okay. So here's our thank you. As Brenda hinted, we're all, well, she just said it, we're all really tired waiting for daffodils and waiting for the COVID to be subsiding. And so we can give you some updates on that, not the daffodils, but on the COVID. And just really want to say again, thank you. When we talk to other colleagues or other people in our work here at the health department, we're always saying, you know, the childcare providers have been on the front line since this thing began, which it began next month. So it's like a year that you've been doing this, and you're hanging in there and you're doing a splendid job. And you're one of the key reasons why Vermont has had such a, you know, we've had too many cases because we don't want any cases, but we've done so well as compared to the other states. And one very real reason for that is the really solid work you folks have been doing out in the front line, and it's really hard. And we thank you so much. So thank you. Next slide. Oh, Margaret's going to talk about vaccines.
Hi, everybody. Ooh, is my audio okay?
Yes.
Okay. I'm Margaret Tarmy. I am at the health department in the maternal child health division and joined you last month. So I might be a new face for some of you, but I've been on the school and child care branch since March. And again, just want to reiterate just how much we value your hard work. This has been a long road. And we know that vaccines is a really hot topic. So definitely wanted to put this at the very beginning of our presentation. And we will also tackle some questions right away about vaccines before we get into the rest of the presentation. So this slide here is really just kind of summarizing where we're at with our vaccination campaign, and really is summarizing that Vermont, after working with state leadership and reviewing the Advisory Committee on Immunization Practices recommendations and Vermont's Vaccine Implementation Advisory Committee, which Rena is a part of, there's been a lot of discussion. This is obviously tough when you have more people than you have vaccine and need to make a plan to distribute. So as you all, I'm sure know, Vermont has really taken the approach of using age grouping to determine the rollout of the vaccine campaign, and the ultimate focus and goal of this is to save lives. So as you all know, phase 1 was long-term care residents and staff and healthcare workers and first responders. We are pretty excited that we are already in phase 3. Tuesday, we took, Sally, remind me, it was like 7,000 calls in the first 15 minutes on Tuesday. For individuals 70 and up. So it just exploded. And we now have about 62% of that eligible population that are registered for their first shot. So it's been pretty wildly successful, this launch of getting people scheduled for vaccine. And this is actually a rather small cohort. So it's anticipated that by early March, we'll be able to move on to the next group, phase 4, of individuals 65 and up. And then after that, we will be able to vaccinate those with high-risk health conditions. So next slide. This slide, this hyperlink that you guys will get a hold of, I don't know if you checked out the vaccine dashboard, but it is pretty snazzy, and we are kind of keeping track of people who have received one shot and then also their second shot and have completed the series. So that's a way to keep tabs on this. I know that there's a lot of frustration amongst amongst childcare providers and, certainly teachers out there who are not in this initial phase of being vaccinated. And we're going to chat about that. But one thing you can do while you're waiting for your turn is you can register at the health department website and establish yourself as an individual. If you've already maybe had some testing, then you already have registered. But if you haven't been tested through the health department website, then you could go ahead and register yourself so that you don't have to do that step once your number's up for vaccine. Another point that we just wanted to add here on this slide is that just last week, Vermont has decided that we will be following the CDC's new guidance for people who have been vaccinated and are exposed. So someone with COVID-19. So if someone's completed the 2-shot series, and it's been at least 2 weeks since their second shot, and they are within 3 months of having gotten their second dose, and they are not displaying any symptoms of COVID-19 since their exposure, they wouldn't have to quarantine. So these types of questions have come up in our work, and that's the latest with that. So next slide, we're going to go over some questions, which it doesn't look like that slide is showing. So let's just pause here. And there were a couple of questions about vaccines. We received a lot of questions in preparation for this presentation, and then also just, every day on our warm line in the school and child care branch about frustration associated with the state's prioritization of vaccines. So one question was, are some school faculty being prioritized? There was an example of someone where, a guidance counselor with no medical conditions got the shot. And so I wanted to just touch upon this prioritization and these frustrations. Dr. Tim Leahy at UVM, medical ethicist doctor, really just want to echo his words and say that, we are doing our best to come up with a campaign that's going to save lives. And this is the approach we're taking. And, maybe there are some people that got a shot, maybe because they wear 2 hats and they're also in, ski patrol or whatever, they have a different role. But every person that gets a shot is one step closer, one day, one shot closer to us having herd immunity. So I guess I'm just trying to say that there's been a really tough conversation associated with trying to figure out these priority groups. And, you all have been on the ground, standing up essential childcare, summer camps, as we've kind of learned more and more about COVID, and here we are almost a year into it. And you are essential to our economy and to the thriving well-being and care and emotional well-being of our children. And you've been essential. And, at this time, we are still having conversations as sort of our distribution changes. I and Sally, of course, are not at that table, but other leaders are, such as Brina, and the early childhood care community is really part of the discussion with teachers. It's kind of grouped in as a group that there is advocacy for. It has not been determined what tier you all are necessarily. At this point, we have an age banding approach, and some of you providers might fall into those groups as the different phases roll out. So we'll go through a couple more questions later with vaccine towards the end.
So, yeah, I can talk about the masks. And you've probably been hearing that there's new recommendations about masking. And we can talk about the variants, but one reason why this is important now is that you've been hearing, we're starting to see the virus variants in the US. And this has always been expected. People like, the experts know that viruses, all kinds of viruses mutate and make new variants. That was well expected. And so now, as we are in the process of vaccinating the population, it's still very important to offset the variants as it comes into the country. It's not like it's, I mean, so, but what I'm trying to say is that we still will, that's another reason why we have to be careful about masking and distancing and all the stuff that we've been doing that we're kind of sick of doing, but we still have to do it even as we start getting more and more of our population vaccinated. So as part of that, CDC was taking another look at what we've been recommending on masking, and they did more research and determined that double masking is more effective than a single mask. And if you get on their website, they have some good explanations as to what this means and what it should look like. They have some nifty videos as to how to do it. And they want, the ideal is to wear a surgical mask and then a cloth mask over the surgical. And you see all these videos now. I'll hold this up so you can see it. These are the surgical masks, as you guys probably know, and it's this little technique if you make a little knot in the bottom of the elastic where it meets the mask, and it tightens it up, because I know when I wear this, it's all loose around my cheeks, and then that's another area where virus can escape. So it's this whole new technique that's really simple to make the masks more effective, and also then to wear cloth mask over, and the cloth mask to be a double layer or two-ply, as we've always talked about with cloth masks. So in all your free time, get on the CDC website, see what it says, and then maybe see how that can be applied in your childcare, especially with the staff, because of course we know some kids, it's hard to get them to wear a mask. The younger ones under 2 aren't supposed to wear a mask, but all the staff are to be wearing masks. So this is something to update in your process in your childcare. So there's masks.
I'd like to just interject a couple of questions that are really directly related to that. And one is, what is the data on efficacy of well-fitting 3-layer masks versus 2-layer masks? And is the CDD now making it a requirement, do you think, for double masking for classrooms or for health screeners?
Good questions. And I think the definition of a good question is, it's a question that's a good question, but we don't have the answer to. I don't know about the data on the efficacy of 3-layer versus 2 layers. I think they feel like the 2-layer is sufficient, and that with the surgical mask is good, and that's what they're recommending. We can talk about this. We have the guidance from AOE for the public schools, like pre-K through 12. We are re-looking at that now. That's, quote, opened up for revision. And they may add some of this in the revised AOE guidance. And then after that's revised, they'll be looking at the guidance for childcare's programs, and this may make it into that guidance. I can't say, but it would, I would assume there's some sort of language in there to accommodate this new recommendation on masking.
Thank you, Sally. So I think, the answer to the next question, should we be requiring our 2 to 5-year-olds to double mask, is we don't know yet. So sit tight until and unless we get guidance to do so.
Yeah.
Continue to be doing what you've been doing. And I have a sneaking suspicion we'll all know when that becomes a requirement.
Okay.
I'm glad that came up. I mean, I sort of figured that you would all want to know, is this sort of an ask for us to do right now? So I think, we really just wanted to bring it to your attention as a recent study and finding of the CDC about the increased protection.
Okay, this is just, you may have been hearing about, I talked a little bit about the viruses mutating. We've found this, what they call the B117. There's a, scientific reason as to how they label these different viruses and their variants. This is the one that was found in the United Kingdom. Burlington City is doing this research in using the wastewater, where you can detect particles of the RNA that are associated with the coronavirus, and they're finding these particles. And so they're feeling like that's evidence that the variant is in Vermont, which is not a surprise. But this helps us get a sense as to like the amount and trends. Is it increasing, decreasing, are there blips? So it's great to have this as a kind of like a database for us as in our epidemiologic role at the health department to help track what's going on, at least in Burlington, and it gives us an idea of where it is or how much. So this is just one part of the research that we're doing statewide and nationally to understand better how this virus mutates, where it is, where is it concentrated, and then we can always be adjusting what we're doing to help offset the spread of the virus. Yes, and the second bullet about, so far the current vaccines are largely effective against the variant. So it's not like, I was just listening to a conversation with Dr. Levine earlier this morning. He says he's optimistic, but this is something we're watching closely to make sure that the variants can be taken care of by the vaccine that we have, and that we are offsetting the variants by steadily increasing the percent of population who are vaccinated. And all the states are now getting a stronger supply of vaccine through the federal distribution system. So just week by week, we're able to increase the number of people we can vaccinate. And so then Margaret addressed this a bit as we go from age bands to people with chronic disease, and then to, as they start to consider people's occupations and public facing occupations, such as childcare and teachers, will get there faster because we're getting more vaccine through the federal distribution system. And there are several questions about, when we say teachers, we have to remember that early childhood childcare programs they're teachers too, and they need to be in this whole occupational designation. And yes, we're constantly advocating for that to happen. And our lovely advocate, Rena Holmes, is at these tables, and she knows to make sure that people say that and plan for that. Next slide. Oh, yeah, this is, we use this slide every time, and there's a little bit of updates every time. So we're working on summer camp guidance, which some of you folks organizationally may be involved in with special summer day program offerings. We're working on that. We hope to have that out in March. We're getting a lot of calls because people want to plan their programs. And the other thing is, Brina's working with like Vermont After School, Let's Grow Kids. I assume you guys are involved in this, and just really paying attention to summer programs and how they can address social emotional health of the children, because that's part of our stress as adults working with children, that we see the stress on the children, and we want to do all we can to help their social emotional health. So a lot of emphasis on that this summer too, in addition to just the social emotional benefits of being in a summer camp, whether it's Circus Smirkus or a pottery camp or a music camp or just run around a lot outside type camp. So we're working on that. As I said, we started looking at the Agency of Education's guidance, the Strong and Healthy Start, and then to look at the childcare guidance, which hasn't really, I mean, it's last August is when we wrote that and was last updated. We're continuing to watch the executive order with the multi-household gatherings. That's still not a good idea, and the governor does not want that to happen. We gave him some talking points for his last press conference about February break and April break, and please no sleepovers, kind of things like that. So that's still something we're trying to caution the public about. You may have heard that the guidance around allowing games, sports games between schools was opened up a few weeks ago. And just yesterday, they put out guidance for music educators. So that was heartening to see too. And that might help with some of these summer camps that are music camps. And then I don't know if any of you have music type programs in your programs, but that might be something to consider as you know, as we're constantly upgrading the guidance and how it affects frontline programs. The interscholastic play, I just mentioned that. Oh, on our website, we have the daily COVID update with the latest announcements from the governor and from other leadership and the latest numbers of cases and the deaths and other metrics that we measure. This is the positivity rate in, we've talked about this. This is like the number of positive cases over, that's the numerator over the denominator of the number of tests done. And Vermont has always had a really low rate of this, and we're very proud of that. And again, some of that's because of your work on the front line. And they have that reported on our website. For the teachers in the pre-K, in the K through 12 schools, they get the, they have the regular surveillance as arranged by the Agency of Education, and those positivity rates are always below 1%, like a lot of times way below 1%. If you'll hear in the news, like some states, their positivity rates are like 20%, it's ridiculous. And in Vermont, we've stayed well under 5% through this whole thing. Some states are using the positivity rates to determine whether you should open or close schools. We don't use that in Vermont because we don't get high enough to know to use it. So we use other criteria. And again, they still want people not to travel. And we talked about the SARA alerts. That's when if you're monitoring your symptoms or you've been positive, you can get these little texts to help you monitor your symptoms and help you count down to when you're day 10 or day 14 and can, you know, it's like your get out of jail card. So that's what, just an overview of this slide. Next slide, on the next slide. Oh, okay. Oh, here's Margaret with her, with all the data we were able to put together.
Yeah, so this is really exciting. We have certainly received requests in our branch for data about, number of cases in childcare settings, or, what is the data on transmission. So every week, the health department has a spotlight on COVID data, and on the end of January, there was one specifically on childcare settings. So we're incorporating that into this chat with you all. So one of the questions that we got in preparation for this presentation today is anyone taking data down in regards to confirmed COVID-19 cases in private early childhood education programs. So we are monitoring this, and when someone was in childcare while infectious, we're able to keep track of these numbers. And this data slide is saying that there's over 1,100 registered programs. So these are childcare centers, pre-K, registered in-home providers, and after-school programs in the state of Vermont. So this is a slide deck about these regulated care places through the Department of Children and Families. So this slide is essentially saying that 67 people with COVID-19 were in childcare settings while they were infectious. And just a quick review on what that means. So that means, 2 days prior to the onset of their symptoms, or if they were asymptomatic, 2 days before their test. So childcare settings that have been impacted by this. So there were 55 settings where there were people in childcare while infectious. So next slide. So this next slide is going over, well, how many outbreaks were there? So we just took a look at how many people were in childcare while they were infectious with COVID. So then what happened? And so just want to kind of frame this that an outbreak is has a different definition than a community setting. So the outbreak definition for school and childcare is that when there are 2 or more COVID-19 cases among children, students, or teachers and staff with known connections in this early education setting. So there's more criteria about that on the bullets below, but these numbers are pretty small. So, this is at the end of January. Of the 1,100 childcare programs, there have been 6 outbreaks impacting 6 childcare settings, and this includes a total of 21 cases. So this is something we definitely continue to monitor. It looks like on an average, there were 3 to 3.5 cases per childcare facility outbreak. So there might have been more than 2. Looks like the average was 3.5 when there was an outbreak. Next slide. So this is, I think, a really helpful slide because it just kind of gives you that sense of how prevalent this really is when you have a case in a childcare setting. This pie chart down here is pretty much saying that 75% of the time, people do not spread the virus to other people. And that's because of all of your hard work. The screening, the masking, the trying to be as distant as possible in this population, the washing of your hands, when people are sick, sending them home, only returning to care when they meet the criteria to return. So this, I think, is a really helpful data point to just really affirm that you all are doing great work, and that when there is a case, the majority of the time it is not transmitted in childcare settings. Just to give you a little bit of perspective, this data point is a little bit higher than the transmission in schools. And, my guess is that it's just that much harder when you're dealing with little people, right? That just, aren't at a desk and are climbing on you and things like that. So it's a little bit of a different setting, is my take on that. Okay, next slide. I guess this is me. So, this is really just kind of another review of what you all are doing, and just to remind you of how critical it is. And I know that it is a lot and exhausting, and we are all tired of this, but it's so important and has been your tool and your armor to minimize transmission in the event you do have a case, and hopefully you don't even get there, and you just are keeping COVID out entirely. Next slide. So I feel like we're skipping over some slides, but we'll just roll with this. So another question that we received was about what happens when you do have a child, or we'll just go, the example was a child who's had COVID, a confirmed case of COVID, they had their PCR test, and the current CDC, if it's been confirmed, is that we are really feeling confident about the immune protection for 3 months. So the question is, if they've had COVID and they come back, and maybe they have a runny nose, what do you do with someone who's within 3 months of a COVID infection, and maybe they have a runny nose, and isn't this runny nose going to potentially put other families through potentially acquiring whatever this child might have, and therefore being needing to maybe stay home and test and stay out of care until they're cleared to return. So, the sentiments on this question were about sort of the parents who seem to think they have a free pass if their child has maybe had COVID and, doesn't comes back and maybe they have a runny nose or maybe another symptom. And so I guess we really just wanted to have a chat about this and review that, it is still, these families don't have a free pass. Your job, and I know it's hard, is to have a high guard here in this pandemic and exclude people who are sick from your care, because right, the kid who's had COVID might have a runny nose and spread it to the other kids, and then the rest of the kids need to go through the process of reaching out to the healthcare provider, maybe getting tested, staying at home until they can return. So, and there was also just a part of this question was just the frustration with having cases in care and teachers being out with quarantine and the amount of time that it takes. And so I guess really just stand firm. This is hard. We're in the peak of winter. There's a lot of illness that isn't COVID, but this is our guard. We need to exclude people when they are sick, and people who've had COVID don't have a free pass. So this return to care algorithm definitely gets into when they can return. The second kind of part of that question that we received was, are we still doing symptom free before children can attend care? So I want to just get you to be super familiar with this algorithm here about the return to care. And so symptoms have to be improving or better in order to return to care. And there's a different set of criteria based upon the complexity of the symptoms and if they, should be maybe tested for COVID or not. So feel free to give us a call at the Worm Line because it does get a little complicated and we're here to walk you through this. But in summary, we are still with a very high bar of keeping only healthy kids in care, and people who've, had COVID confirmed don't get a free pass to show up at care, not really well. Next slide. Yeah, so just give us a call at the school and child care branch. Sally, I'm going to hand it on over to you.
Oh, sure. Right. Well, you guys know this number, and we're there in those from 8 to 3. We're fully staffed. We have some. We take some standby hours over the weekend, and then there's an option. Oh yeah, option 7. I'm sorry. Is if it's out of those hours and you have something really urgent that you need to report, such as somebody just called and said, my child who's been in your child care all week is positive. The thing is, we help with technical assistance, and we call it the OPR, Outbreak Prevention and Response Team, are the experts at working with the contact tracers and helping you just, get more precise as to where the child was or where the teacher was or where the family member was and who actually might have been exposed. Margaret and I and our colleagues on our team are getting more trained up to work with the OPR people to help them out, because a lot of them are being pulled to help with the vaccine clinics. So we're doing a little shift. It's kind of a nice sign of success that they're getting pulled to do vaccine clinics, because a couple of months ago, we didn't even have vaccine clinics. So it's a progression that is, again, indicating there's a light at the end of the tunnel. Anyway, so I think you folks know this stuff, but just give us a call and we'll talk through. I'm looking at some of these questions, and they're complicated, and it's the type of questions we get. So as we get to the Q&A, we can do some of them, but some I'm going to have to research. So that's what we do, and feel free to reach out. and more. Common for people. Oh, here, we may have had this up in the other slides. This is on our website, and this is, you know, even the public health experts need a cheat sheet, and this is it. So you start at day 0, which is the date of exposure. This is for quarantine. Day 7, you can test out. Day 14, you can be out as long as you don't have symptoms. This is easier to do now than months ago. I just keep talking to you folks as if you're old hands at this, because you are. If you remember, months and months ago, we didn't have a lot of testing clinics, and we have a lot now. And there's openings at a lot of them. It's not like they fill up in 2 seconds. So one thing Dr. Levine is asking us is, again, to keep the spread of the virus low while we're working very hard to get the full population vaccinated, is if you realize you've been a contact with someone and it was 2 days ago, get tested, and then you can get tested 5 days later. Previously, we would say just wait 7 days because we didn't have enough tests for everybody to get tested twice, or 3 times, and now we do. So, so we're being more aggressive with the testing, and this is some guidelines that we use when advising you folks on the phone. This is for people who are quarantining, and then we have a different cheat sheet for those who actually have the actual disease, and that's that 10-day isolation period. So, so that's the other scenario that we often see.
Sally, let me just tack on to this.
Yeah, yeah.
I'm sorry if the audio was just really muffled. One of the questions was about clarification with testing, and Sally, you know, alluded to this. So, you know, if you are exposed, you can get tested within, you know, 2 days after your exposure. And then really the key time to get tested again, if you get tested more than once, is on or after day 7.
Yeah.
And your test needs to be a PCR test.
Yes.
And it has to be on or after day 7, and it be negative for then you to be released from quarantine, and you have to remain asymptomatic. So if you develop, you know, say you got a PCR negative test on day 8, if you develop symptoms, you need to remain in quarantine for the rest of the time, and ideally get tested again, because you've then become symptomatic.
Yeah, and you folks know, I think we use the PCR tests in Vermont. They're the gold standard. And sometimes you hear about people getting tested twice, and that might mean the first test is the rapid antigen, which is has its uses, but it's not as accurate as the PCR. So often you'll hear about someone getting, or you yourselves may have experienced, you get a positive antigen test or a negative antigen test, but you still have symptoms, and it's like, well, let's get tested again with the PCR, and that'll give us a better accuracy. Oh, here's the contact tracing. Was this that you folks know about this? This is, we talked to you a little bit about this in our team, but this is when the contact tracers call after they've been notified of a positive case, and they talk to that person about who they may have been in touch with, and the general standard about a close contact is someone who's been within 6 feet over 15 minutes with the person who, keep calling them a case, but they really are people who are positive for COVID. And that's obviously things like family members and or friends, and they've done a lot of close contact. But then it's like we've talked about a couple of questions lately on the people in your programs who do the health screening. I don't know if you do it. Some of the schools have the person doing that, but it's a quick, you know, less than 15 minutes. The person doing the health screenings is in PPE, so those are not close contacts. That kind. So we help you work that out, and the contact tracers do too. And I mean, we can talk more about this, but I think a lot of you have been exposed to this process and kind of know what I'm talking about. And here it is again. You folks know this. So that, and then I think we're for some more questions. This is the last slide.
I guess so. I feel like some of our Q&A slides, I don't know what happened to them,
Yes.
but they are.
So Kathy and I, so just so everyone knows, the slide deck that goes up on the Let's Grow Kids website is going to have some of the questions that you submitted ahead of time. We had about 8 more slides than the ones that you just saw. And Sally and Margaret and I were like looking for them, like, where are they? They're not there. So I think what happened was maybe we got a preliminary slide deck that is what got put up. And in fact, we have more of your questions with live answers. With the questions you asked ahead of time. So here's what I'd like to do now. So those questions are answered in the slide deck, and there are great links along with the answers. So we're going to not go there now, but you will find them when you see that on the Let's Grow Kids website. I'm going to go to the questions that came in while we're talking, and some of them Sally and Margaret you've touched on, but like you said, at some point it's complicated and some of them you may have to research, and many of them are in the same vein of there are 2 extenuating circumstances in addition to what you just said. So if a person has had a COVID-19 vaccination, they've gotten both of them, do they still need to quarantine when they come to Vermont? And what if they're visiting a family who has kids in my program and they have not yet had their vaccination?
So one is we're suspecting this might be addressed at the governor's press conference tomorrow with some of the out-of-state travel. And at the moment, some of what Vermont's doing is a little different than what CDC recommends. And we don't always do what CDC recommends. We take what they recommend, and like AAP or the Association of Family Practitioners and the WHO and then Mark Levine and our Patsy Kelso, our epidemiologist, they filter them all through and say, what does it look like in Vermont? And how do we apply these in Vermont? And most of the time we apply them directly, but like the new school guidance at CDC, we're doing all that already. So it wasn't like a big, oh my gosh, we've got to start doing all this right now. But it does kind of say what other states have not been doing. So where was I going with that? So the governor and Mark Levine have been looking carefully at this travel guidance, and the governor wants to be very intentional and keep it very close and not just open it up in a irresponsible way. Those are my words. So he'll be talking about this more tomorrow, but as we're finding more people getting immunized, and there were questions on how long does the immunization, how long is it good for, all of that. We don't know all those answers yet. Even people like Dr. Fauci don't know all those answers, and we're still doing lots of research to come up with this.
Right.
And just to kind of go on this a little bit, eventually we're thinking this COVID might look like the flu, in that every year people will need to get a COVID vaccine, just like every year we're to get a flu vaccine. And that's because it mutates all the time. And each year when there's a flu vaccine, it's a different vaccine, because the CDC epidemiologists and virologists and all have been assessing as to what the mutants will look like. And so they develop a specific vaccine every year. And that's where we might be going with COVID. So to just keep that long-term frame as we're looking at this short term.
Let me just tap on Sally and say that, as the executive order stands right now, or the current guidance, if someone has been vaccinated and completed the series and it's been 2 weeks post-vaccination, they at this time are still subject to quarantine if they travel. They are also, people who have been just vaccinated completely are still subject to the current executive order and not allowed to gather.
And that gets at quite a few of the questions. If I have, what if my program has a teacher who was vaccinated but then exposed to a positive case? Do they need to quarantine? It sounds like the answer is yes.
So let's talk about that. So if someone has been vaccinated, they have to have had both vaccines and be 2 weeks after their second vaccine, and be at this time within 90 days of that second vaccine. And if they are exposed with all of that criteria with the vaccines, would not need to quarantine. And it's, that's what we have. So if it's, more than 90 days at this time that they got vaccinated, which is highly unlikely, but we are kind of getting there as time moves along. That's the guidance that we have right now. And it sounds like, as we have more data, that might change, and there might be a longer protection period.
Well, and that goes right to another question. So the exposure happens. So if you were vaccinated, but then the exposure happens after 90 days.
The current guidance is that you would quarantine.
You would quarantine.
Yeah.
Yes.
Yeah.
And there are also a number, and I think this question comes up in some version every time we meet with you. And that is around grandparents or other sort of people who might want to have close proximity with kids who are coming to programs. So once grandparents have received both of their vaccinations, can they come and visit their families? Can they stay overnight? And is that related to the 2 weeks out from the second vaccination? And I hear you say the advice is still to not gather. How does one handle the grandparents wanting to see the kids in my program?
Right. So, I mean, under the current executive order, if you had grandparents from out of state that completed their vaccine and were with 2 weeks post their second shot, they would need to come to Vermont, quarantine for 2 weeks, or test out on or after day 7 with a PCR, and stay in Vermont lodging. And you could meet them outside and keep your distance and have it not be a social gathering if you stay more than 6 feet apart and mask and are outside essentially. So again, that's the way it stands right now. And it does sound like there will be more of an update tomorrow from our governor regarding travel for those who've been vaccinated, but we currently still have a ban against multi-household gatherings.
Yeah, I think that the word that we can say, what I'm hearing and what I think we can tell families of the kids in our care is continue, continue as we have been. So continue to be cautious, continue all the cautionary practices. I'd like to shift it to, well, I want to read one statement, not a question, that I think is important, that someone made. Bennington's positivity rate has been higher than the rest of the state. So just a reminder that we don't relax just because our state has low rates. And I think that's a good reminder. And then also that there's a series of questions that talk about the different levels of vaccination. And so, is there, do we think that there's going to be a phase that includes childcare and public school teachers? I know you said
we don't know
the answer, right? Exactly.
Certainly the teachers and early child care providers have not been this is our current plan, and that's all we know at this time, and certainly advocating for you all as essential care providers and teachers, and just the well-being of our children and the critical work you're doing is reason to get you vaccinated. And there's advocacy for that, but we don't have a timeline or any more information if that's part of the plan. That's all we know right now.
But
And thank you for hearing these questions, even when we suspect that probably the best you can say is, I don't know.
yeah,
I feel like that's also what, like, many of the people who are running programs and spending their days in classrooms and on the floor with little kids are telling families, we're doing the best we can with what we know.
Yeah.
And that's part of the wearing thin, because we're like, okay, it's
yeah,
almost a year now. Could it be time yet to
Yeah.
relax anything? And I think what we keep hearing is keep hold on to the cautionary practices. Um, we have about 5 minutes left, and I was wondering if there was anything that you wanted to say further in response to any of the questions. If not, I'm going to go. I am going to go to two of the questions that would have been in the slides if we had had the broader slide deck.
Okay.
yeah. I don't know if you'll get to these slides, and we can do it in a written Q&A. There is one about the vaccine affecting fertility,
Right.
and that's a we sent you some links. That's something that's not been shown to be true. They're thinking some of the background thinking on that was not out of the academic research field and maybe out of the just general public field. So that's nothing to be concerned about. And with the vaccine, with all of this, there's been, we well know there's been a lot of rumor, a lot of odd ideas coming out, and that, again, if you're hearing something that sounds a little, or you just want to research more, again, in all your free time, get on our website, get on the CDC website. And then there's other good websites too, like WebMD and that sort of thing. And with the search capacity, you can find answers really easily. And there's another one about they were talking about experimental drugs, and I wasn't quite sure what that meant. But like I was thinking that we have the emergency use authorization for the vaccines, the EUAs, and that's a way of the FDA officially approving the vaccines. And there's criteria. It's just a way of speeding it up, because usually a lot of the approvals takes a couple of years, but this is because it's a public health emergency. There's certain criteria. It's not willy-nilly, to put it that way, for the vaccines to be approved through the national committee that approves vaccines. So that's the emergency use authorization. And then on some other webinars I've been on, people keep asking about when children can get vaccinated, and the vaccine right now is not approved for children, but they're just doing a lot of research and trying to get vaccine for children too.
And we have 2 minutes left, and I'm just going to remind folks that we will put the full slide deck. So what you saw today, plus the answers, the questions and answers that you submitted ahead of time, which they'll be part of the slide deck that gets posted to the Let's Grow Kids website. And that has not only the Department of Health answers, but also links to some of the more information about some of the answers. And I think we covered all of the ones that came in today, and or they were addressed in the other slides. So excuse me, that we're missing. Let's see, was there one more that I wanted to just, oh, there was one, I think there was one set that said, when should I have a COVID test? And do either of you have the answer right there? Because I think that's a question that a lot of people ask. So that might be a good one to cover, and then we'll end on that.
Sure. When should I have a COVID test? You should have a COVID test if you have any symptoms. You should reach out to your healthcare provider and talk to them about testing. You should get a test if you have had any known exposure to a confirmed case. And in those circumstances, you could get tested twice right away, as soon as you find out, 2 days after the exposure, and then again 7 days after the exposure or gathering. And anytime you've had a social gathering with people that you don't live with, So really, anytime that you think you've been exposed to someone with COVID-19 or are a named close contact or have had a social gathering, and then if you're symptomatic.
Yes, so, and my apologies to all of you participants that we somehow didn't get the your Q&A in the slide deck. Again, they will be in the posted set of PowerPoint slides on the Let's Grow Kids website, and we'll get those up no later than tomorrow, as well as the recording. So thank you, Margaret, and thank you, Sally, for answering our questions and for giving us some updates. And thank you for all the links. I think folks can really feel like we have a resource in you, and we know we can pick up the phone and call you. We can click on the links that you share. So I want to thank you for your time, and thanks everyone for who participated today.
Great. Thank you.
Have a
Thanks
good
for
afternoon.
organizing this.